Now, let's discuss the assets and limitations of Rorschach. So, one asset is it is somehow popular because of its mystery and power that it produces. Because the common understanding of Rorschach is how could something like 10 inkblot cards can have a revelation about the inner aspects of our personality. Another asset is its high resistance to faking. So it was argued that because the true meanings of Rorschach responses are not easily understood by the untrained individual, the respondent cannot easily invent a fake response. Another major asset is its ease in administration. In fact, for the comprehensive system, it is the administration phase is about 50 minutes and shorter for the RPAS. For the limitations, so we all know that it has issues with its reliability and validity. And though the RPAS is a improvement of the comprehensive system, it was noted that RPAS is relatively new. Aside from that, errors can be can come from many different areas. So, for example, administration and coding errors, as well as poor handling in the interpretation, and aside from that, the norming and the age or education of the examinee, and on the part of the examiner is his or her possible examiner bias, such as illusory correlation or primacy effect. Another limitation is practitioners need more extensive training. So even if the practitioner commit 2 semesters or full curriculum to studying how to administer, score, and interpret Rorschach, there are many other tests that are both time efficient as well as more robust in psychometric properties. And aside from that, there is an increase in the required roles and skill sets for practitioners. So meaning to focus only on developing your skills on Rorschach is not practical. Another important limitation is its limited use with children, specifically those children under the age of 14 years old. So using Rorschach in a case of child custody is not a very practical decision. Lastly, for the comprehensive system, the coding, scoring, and interpretation of responses takes approximately a total of 2.5 hours. Though RPAS shortened it because of its web-based scoring system. Okay, so there are reminders, no, when we are using diverse groups. First, clinicians should use the proper norms. So, if the clinician is working on cross-national settings, the international norms published by Mayer should be used. Aside from that, culture must also be considered because different cultures has different interpretations of, let's say, a construct. So, for example, um, other cultures have different value to introversion versus extroversion. And also the client's degree of acculturation must be considered, as well as clinicians to be very careful when using samples such as children or adolescent populations. Okay, so let's discuss Exner's Comprehensive System. So during the administration of comprehensive system, we must put in our mind that the entire duration of administration must be standardized with particular emphasis on minimizing the variation of the whole procedure. Step 1 is about introducing the respondent to the technique. So, it was noted that the examinee must feel relatively comfortable during the testing procedure. And then, normally, it can be very difficult because there are cultures that associate test to anxiety, which can be a hindrance to the examinee's perception as well as the free flow of his fantasy, in which are all very important in the whole duration of the process. Aside from that, as examiners, we must avoid um, anxiety-provoking words such as intelligence or ambiguous stimuli. So, and aside from that, if respondents push or ask for more details about the process, examiners are advised to respond like saying, um, additional questions will be answered after the tests are completed. Step 2 is about giving the testing instructions. So it is advisable that the examinee and the examiner set side by side and that the examinee is encouraged to hold the card. So start with the ambiguous question, what might this be? So it is also recommended that if the examinee asks, what should I supposed to see in this card, the examiner must reply, people see all sorts of things in the blot, or simply, response is all up to you. The goal of step 2 is to give the examinee more autonomy and freedom to respond to all ambiguous stimuli in his or her own manner. And in addition to the sitting arrangement, which is side by side, this is to avoid the non-verbal cues coming from the examiner. Step 3 is the response or association phase. So here, the examiner is encouraged to say to the examinee, if the examinee is very persistent in asking what should he or she supposed to see in the cards, the examiner rather is encouraged to say all responses is up to you. Aside from that, the most important thing to do in this phase is to record the responses verbatim, as well as to record the time interval. So the time interval starts from the respondent's first viewing of the card, and then another time is the when the respondent gave his or her initial response, and then another record of time is the when respondent the total time that is spent on each card. Clinicians during this phase are encouraged to use a series of abbreviation. And aside from that, it is also important to record or to note any unusual responses to the cards. So, for example, if there is an apparent increase in anxiety, or if there is wandering of attention, and then as well as acting out on any of the percepts. Step 4 is about inquiry to collect more information. So it is done when all of the 10 cards have been completely administered. And then the purpose is to collect additional or clarificatory information rather than to obtain new responses. Okay, so coding of comprehensive system. It is recommended to look for this book, the Exner 2001 A Rorschach Workbook for the Comprehensive System 5th edition, for us to have accurate coding and scoring system, because our reference book only give us the basics or the how this comprehensive system works. So here, the first thing to look at is the location and the developmental quality. So it is recommended to look for this table 11.1 and 11.2, and all throughout the discussion, there are many tables in the book. It is recommended to check on it so that understanding can be established during the discussion. So the location is about the entire inkblot, or is it just the specific area of the inkblot? And then the developmental quality are those symbols that indicate the quality of that response. So this is how it looks like, no, in our book. Again, I encourage you to check on it in the book because I cannot fit the entire table here, or else the quality of the picture will be compromised. Next in the coding are the determinants. So it refers to the characteristics of the blot to which the examinee responds. So it might be shape or color or texture. So there are also determinants that can be movement, such as if the picture is, it is meditating, or is it fleeing, or is it lifting. Also, in the coding, card 1 is considered to be an ordinary form of quality response from non-psychiatric population. Another from coding is the content. So the content are those characteristics that that the examinee perceive. So it can be human, it can be an animal, or it can be a body part or anatomy. If there are two or more content categories, it should be coded with a comma. And then if there are contents that are not on the list, it should be coded or identified as idiographic. So in table 11.5, you can see the many contents that are categorized in the coding of comprehensive system. So here is a portion of table 0.5. So as you can see, if there is a content of a whole human, it should be coded if the response is it a whole human form, or is it an actual human? And then aside from that, if it is fictional, it should be indicated if it is giants or fairy tale or angels and devils, so that the coding can be accurate. Another in the coding of comprehensive system are popular response, which refers to the presence of frequently perceived responses. And then we have special scores with which determines the unusual characteristics of the response, such as unusual verbalization or inappropriate logic. So this is how it looks. We have card 1. Usually, the common response is it is a bat or it is a butterfly. And then for verbalization, we have this deviant verbalization.